Okay, folks, I want to talk about AIDS again. I'm talking about the cures for AIDS. You know about the Berlin man, but that's such a hard and complicated surgery, it's probably not feasible for hardly anybody to use. It's expensive as all get out. Then we've got treatments such as PrEP treatment, pre-exposure prophylaxis treatments. It's called who.int. It's kind of like a vaccine, except you have to continually take it. And you have to have it in your bloodstream before the exposure point. In other words, you have to take it for weeks ahead of time, or keep taking it for literally the rest of your life. If you're like a sex worker or something and you want to protect yourself. Then there's PEP treatment. PEP treatment is a cure too, but it has to be administered within 48 hours of the point of exposure. Right now, we don't have a cure outside of those three. In other words, we don't have a usable cure in as far as people who've already got the disease. There's work going in that direction, but we haven't developed any medicines that can do more than zero out the thing in your bloodstream, which for some reason it comes back, and that's just a way of lying. So we have PEP treatment, we have PrEP treatment, then we have the Berlin thing. The Berlin thing is way too complicated and too costly to even consider giving to a large number of people. And we have tens of millions infected. Now, whether they can find some way of utilizing the Berlin figures and isolating something that could be used to inoculate people against the virus, they're trying that now. It's a genetic therapy. If it pans out, we could have a cure for the AIDS virus, even if you've already got infected. But like I said, that's still in an experimental stage. Knowing when you are exposed to the virus, if you want the only available cure for that particular realm of realities, once you identify when you've been exposed, you know in 48 hours you can get PEP treatment to cure you. Assuming prior to 72 hours before then, you hadn't tested positive or had AIDS. Now, the normal system that I came up with here is that you would have a rapid AIDS test to determine whether or not you already have the AIDS virus. If that comes up clean, then a PEP treatment would be initiated to keep you from catching AIDS. If you have sex with somebody with growing sores, or share needles by accident that night, or whatever. That's the closest thing to a cure we have currently. My test, my AIDS exposure test, all it is looking for growing sores, hemorrhoids, or shared needles. It's a lot of people fall in those categories that have AIDS. Well, I thought I'd say that. Have a good one.